Okay, guys, so let's start talking about death investigation. So I know most of the times when you guys hear about death investigation, it's normally something on the news, and a lot of times it's tied into a crime or a criminal investigation. But really, death investigation does a lot more than that, okay? So realize that when we look at statistics across Iowa, and really this is across, citywide, countywide, statewide, nationwide, the vast majority of deaths are natural deaths, so they're not criminal in nature. But of course, we don't hear about them. We only hear about ones that are homicides and suspicious deaths. So, I think the statistic that, has pretty much been stable for decades is about 93% of deaths are natural. Okay, it doesn't mean that it's when we want it to happen. I mean, a heart attack is a natural death. People can die suddenly of a heart attack at a young age. It's very tragic, but it's still natural. But we normally don't hear about those. Okay, so it's kind of skewed in that you're only hearing about the ones that are suspicious and criminal. But when we talk about death investigation, the term we use is medical legal, okay, which is shown up here. So that simply means that we're tying together medicine, but then also law, okay, which is really what forensics is, which we talked about in Unit 1. And really, when someone dies, there's a lot of legalities that go with it. There has to be a death certificate issued. There's insurance issues. There's, a will, if the person had a will. So yeah, there's a lot of legal aspects with even just a natural death, okay? So that's why we use that term. I'm probably not going to repeat that term every time. I'll just call it simply death investigation. But the purpose of a true medical legal death investigation is the investigator wants to establish both the cause of death and then also the manner of death, okay? And these are actually two completely separate things. So the definition of cause of death, which we abbreviate COD, is basically the medical or physical or scientific reason why that person died. Okay, so the true definition is it's whatever disease or injury initiated the train of morbid events, okay, meaning that a process was started that led that person to die. This can be something that happened decades ago if a person is in a vegetative state for a long time, or, it can be something that happens right away. So a person sustaining injuries in a car accident that leads them to, bleed to death or whatever the actual cause of death is. Okay, but it's always the medical reason. Now, if you look at a typical death certificate, actually the cause of death can be really complicated. And in fact, when in one of my courses that I took at the University of Florida, we did an entire unit on filling out death certificates, and it's super complicated. I found it really difficult because there's contributing factors. There can be things like the person had heart disease, or they had alcoholism, or they had asthma. There's all of these contributing factors that maybe didn't lead directly to death, but certainly contributed to that person's death. So yeah, it can be really complicated. Okay, so that's cause of death, the medical reason why that person died. The manner of death is termed as the circumstances surrounding death. Okay, and there are 5 categories of manner of death, which I'll get into in a little bit. And manner of death is abbreviated MOD. Okay, so here's an important thing, and especially for those of you in the class, and I know we have some that want to go into law enforcement, or perhaps you want to go into crime scene investigation. I think this is a really important tenet, and one that I always adhere to and have adhered to throughout my career. Treat every death as if it's a homicide until proven otherwise. Okay, obviously, scenes can be staged for someone to, I want this to look like an accident when it was actually a homicide. You can have something that looks like a homicide, but it was actually a suicide or an accident. But the thing is, with death investigation, a lot of times once that body is taken away from the scene, you don't get the chance to go back and rework that scene. And really, that's true with every crime scene investigation. But when it involves a death, treat it as if it's a homicide. And then, if the evidence suggests that it's a natural death, okay, well, there you have it. But at least you took all of the proper measures that in case it is a homicide and it becomes criminal, that hopefully all of the evidence is intact in terms of chain of custody, the scene was worked properly, and so you have that evidence if you need it. Okay, so if you're going into law enforcement, death investigation, please, keep this in mind. You don't want to rush through things and say, oh, say for example, an elderly woman, she's 90, she's found in her bed, appears to have just passed away in her sleep. Okay, great, you signed it out as a natural. Well, maybe then, you hear from relatives that actually her nephew was talking about how badly he needed her inheritance money or her insurance money. And so maybe there is, kind of a criminal element to that homicide. Unfortunately, grandma has already been buried or she's been cremated and you don't get to go back and rework that scene. So, it's important to take photographs, process, the scene, talk to people on the phone. When was this person last seen, etc. And really cover it thoroughly. Don't just assume something. Okay, so let's do a couple of examples, okay, of cause of death, of manner of death. So let's say that we see a man, or, law enforcement finds a man deceased. He's laying in a large pool of blood. We'll say that maybe he's, in his mid-50s. His family hasn't heard from him, and so they ask law enforcement to do a wellness check at his house, and they find this. Okay, so when his body is sent for autopsy, the autopsy shows that he exsanguinated, which is the fancy medical word for basically he bled out. And he bled out because he had a huge hemorrhage on his esophagus. Okay, so an esophageal hemorrhage is something that is very, very commonly seen in people who are very long-term heavy alcoholics. I mean, decades of heavy drinking. Okay, so let's say the forensic pathologist determines that the esophageal hemorrhage developed because of his long-term alcohol abuse. So his cause of death would be that esophageal hemorrhage that developed and led him to bleed out. Okay, so it's exsanguination due to hemorrhage. The manner of death is natural. Okay, even though, it was due to long-term drinking, it happened suddenly. It wasn't when he planned to die. We'd all like to just, pass away when we're 99 and fall asleep in our bed. However, because it involved a natural process, the manner of death is still going to be natural. But on his death certificate, absolutely alcohol abuse is going to be listed as a contributing factor. Okay, here's another example. Okay, let's say we have a fella, he's 25 years old, and 5 years prior, he was at a bar drinking and got into a fight with another patron. They're having a fight, and we don't know anything about maybe he was the aggressor, maybe the other person was an aggressor. I don't know any of that information. All we do know is that in that fight 5 years ago, he was hit and he ended up hitting his head, okay, because he was injured in a fight. And because of that brain injury, he has been in a vegetative state, which basically means in a coma, in some type of long-term care facility, like a nursing home for 5 years. Now, when people are in nursing homes, and especially if they're in comas, their muscles start to atrophy because they're not up and moving around. They tend to be susceptible to other types of infections, especially pneumonia. So while he's laying in the bed in the long-term care facility, he then develops pneumonia and dies. So his immediate cause of death, what led to that death, is going to be the pneumonia, okay? He went into probably respiratory arrest. He became septic, which means he had lots of bacteria in his bloodstream, his organs shut down, and that's why he died, okay? But the contributing factor is that he was in a vegetative state due to the blunt force trauma that he suffered in that fight 5 years prior, okay? So basically, he would not have been in the vegetative state, in the coma. He wouldn't have developed pneumonia and died if he had not suffered the injury from the fight. Okay, because of that, his manner of death is going to be listed as a homicide. And homicide means death caused by another. Okay, now one really important key that I want you to take away from this is homicide is a medical term. It is not a legal term. Okay, so for example, if a police officer is justified using deadly force against a suspect who's, trying to shoot at him or, rushing at him with a machete, the manner of death of that person is still going to be listed as a homicide, right? Because the police officer had to use deadly force, they had to shoot that person, and unfortunately the person died. So it's still a homicide. The death was caused by another, but likely if it's justified, that police officer is not going to be charged. So it gets confusing because you'll hear, especially on TV shows, oh, we're the homicide unit. Or, Homicide, Life on the Street, which was a really popular show that was on a couple of years back. The legal term is actually murder or manslaughter. Okay, so homicide just means the taking of one life by another, but it doesn't indicate that a person is responsible legally or that the person, had mens rea or, previous motivation or a premeditation to actually kill that person. Okay, so biggest takeaway, homicide is a medical term, not a legal term. So what types of deaths actually require a death investigation? So it's basically any death that is sudden, unnatural, unexplained, violent. Okay, they have to have a documented death investigation. However, death investigation does not always mean an autopsy. And in fact, there are many cases that do not get an autopsy, okay? It could be, for example, just the death investigator at the scene taking photographs, doing an investigation, which means a lot of phone calls. Actually, death investigators, I think the majority of their time is spent on the phone. They want to talk to friends and loved ones, find out, when did you last see this person? What was their state of mind? It's looking through medical records. It's looking through social media, texts on their phone, those types of things. And perhaps that type of investigation gives them enough information about, how the person likely died and what the manner of death was. And so they don't need an autopsy, and maybe they don't even need to be seen by a pathologist. It may mean that they want samples for toxicology taken because they want to know if that person was on any prescribed medication or were they using illegal drugs at the time of their death, and still don't need a full autopsy. Okay, autopsies are actually really, really expensive, and forensic pathologists are limited in the number of autopsies that they are allowed to perform every year. And if they go over that number, their office that they work for can lose actual, certification or, approval to do those autopsies. I know that was a problem with the Iowa State Medical Examiner's Office in Des Moines because they were just overworked. Well, you can't go over the number of autopsies allowed per year. So many deaths do not require a full autopsy. Like I said, some may just be an external examination by the death investigator. Some may want to pull samples for toxicology like blood and urine. But if it's anything sudden, unnatural, unexplained, violent, yeah, it has to have some type of death investigation. And obviously the one that would be the most thorough would be, having an autopsy, whether it's here in Iowa City. So the University of Iowa actually has 2 board-certified forensic pathologists that can do autopsies, but most of the time they're sent to the state medical examiner's office in Des Moines. And I know it's in a suburb of Des Moines. I can't remember. I just always refer to it as Des Moines. The type of deaths that don't require a death investigation are natural deaths where the person is directly under the care of a physician, and basically they know that death is coming. So, for example, my mom was put into hospice care, okay, and hospice would come in and, helped her with end-of-life care. Everything was documented. She was under the care of her doctor. So when she died, and we knew she was going to die, that is not a death that needs a full death investigation. That is one where her doctor was just able to say, yes, she died of this condition, and signed it off as a natural. Okay, an example that would need a death investigation, for example, there was one person that died because of the derecho on August 10th. I believe he was out riding his bike on a trail and most likely was hit by, a falling tree limb or maybe an entire tree. So obviously that's an unnatural death. So that would require a full death investigation. Okay, so that's an example of that. So let's try to demystify what an autopsy is, because of course, autopsies on TV are always treated as, scary, and, it's something that you're basically, cutting open a human being. So the term autopsy means to see for oneself, okay? So it's the post-mortem, which means after death, dissection of a human body. And yep, it sounds terrible, but the way I look at it is it's really the last time that a person goes to see the doctor. Okay, so let's say that you guys, you feel like you're getting influenza, or, let's say it's not COVID-19, because I hope none of you ever get COVID-19, but let's say you feel like you're getting the flu, and so you go to an urgent care clinic. Obviously, you're going to meet with a doctor or a nurse practitioner. They're going to ask you, okay, what kind of symptoms are you having? And you're able to tell them, okay? A person who's deceased obviously can't tell the doctor what happened to them, and so they have to tell them through their injuries, through their toxicology, through their blood work, and through the doctor looking at their tissues and their cells under the microscope. So I tend to think of it as it's a physical exam, except the person can't tell the doctor what's wrong with them. And so, yeah, they'd have to do a dissection. But realize an autopsy is governed by HIPAA, which is the privacy law, the confidentiality law. That means that when you go to the doctor, your doctor can't say anything about, the exam that they performed or the results, unless usually there's a release that you sign so that they can release it to your insurance company. But it's confidential, okay? No one has a right to your information or what what happened at the doctor's office. The same thing goes for an autopsy. So, there's a lot of paperwork involved if a family member wants to see an autopsy report, because it is considered confidential, unless the doctor has to testify in court. Then it becomes more public record. So I've been at a lot of autopsies myself. I can tell you it's a very profound experience. The first autopsy I attended was in 1990 in Buffalo, New York. It was a 45-year-old female who actually had aspirated on her own vomit due to excessive drinking that night. But I literally recall it like it happened yesterday. I can tell you what she looked like. I can tell you what the room smelled like. I can literally remember every part of that autopsy. So, it's a big deal when you see another human being being dissected like that. So it's not something that anyone takes lightly. I've never been at an autopsy, and attended a lot in Chicago and a lot in New York, where the person was not treated with the utmost respect by the pathologist and everyone who was in that room. So I know sometimes on TV they'd show people joking around in the autopsy suite, and that's for TV. I hope to God that doesn't actually happen, because it's incredibly disrespectful to that person and to their family. But I've never seen that happen. It's always been a very respectful environment. Okay. You also may hear the term necropsy. So necropsy actually means when a postmortem dissection is done on a non-human body. So I told you before that I was involved in veterinary forensics. So when we look at animal cruelty cases, animal torture, dog fighting, often we have a deceased animal and a veterinarian basically does an autopsy on that animal to determine their cause and manner of death. We refer to that as a necropsy simply because it's a non-human, it's an animal. Okay, so autopsy, it's just simply a post-mortem medical examination, and the goal is to figure out the cause of death. If the person had, a disease that was really extensive, figure out the extent of that, basically figured out, what caused them to die. And when we talk about a forensic autopsy, and I combine this also with medical legal, so the pathologist is trying to provide, one of the main questions may be, who is this person? Because maybe it's a homeless person that was found deceased. Maybe it was a person who's not physically identifiable because they're very decomposed or they died in a fire. But they may be there to establish identity. They certainly want to determine the cause of death and manner of death, but time of death becomes really important, and a lot of times at the autopsy, they can determine if even a crime was committed in the first place. And if it was, well, then let's try to collect evidence and come up with timelines to help law enforcement, figure out who did it and bring that person to justice. Okay, so it's not that autopsies are easy to look at. I don't recommend trying to see one unless you're a person who's actually going into law enforcement or medicine, because it will stay with you. It will stay with you for the rest of your life. But, they are interesting and they're incredibly important. So that was the difference between a forensic and a clinical autopsy. Okay, so there's two main types of autopsies, forensic and clinical. So a clinical autopsy, it's basically to advance medicine and medical knowledge. Okay, so basically, the person has a disease. It's been established before death. Okay, that's what the term ante-mortem means. That means before death. Okay, so the fact that you guys are all alive means that you are all ante-mortem. And the person is going to die. And so it's basically asking permission to autopsy that person after death to collect samples to help medical knowledge. Okay, so, and I can actually give you an example from my own life. Unfortunately, the older you get, and I'm 56 years old, you tend to know more and more people who unfortunately die. But I had a family friend who was diagnosed at age, I think he was 39, with a very, very aggressive type of leukemia. And literally it was 6 weeks from diagnosis to the day he died. Okay, so very, very aggressive. And the docs at the U of I tried every type of chemotherapy they could on this young man, and he still died. Okay, it was literally like this cancer was completely resistant to chemotherapy. So actually before he died, and obviously there's a lot of psychological help and, care that goes into preparing that person for death and helping the family. But his doctors asked him, could we do an autopsy on you after death and take some samples to help us understand this cancer, do research on it, so the next person who gets this diagnosis, hopefully we can come up with an effective chemotherapy drug that will help them and help them live longer, or, obviously the best case scenario would be cure that type of leukemia. Now, he could have said no, but he said, yes, absolutely, I want to help people even after I'm gone. And so in this type of autopsy, they know what the cause of death is. They're doing it basically to look through the tissues, find out how extensive the cancer was, and then to take samples to be used for research. Okay, so that's what a clinical autopsy is. And a person does not have to be a forensic pathologist to do that. Okay, they can be a regular board certified pathologist. And we'll talk about the differences in the next lecture. So a forensic autopsy, and this is the same definition that was on the previous slide. The key between a forensic autopsy and a clinical autopsy is really that the pathologist spends as much time examining the outside of the body as they do the inside. Okay, so clinical autopsy, you know, we know you died of cancer, so we'll do a Y incision. We're going to take samples, but, you know, we know, and we just want to study the extent of the disease. If it's a forensic autopsy where, hey, we don't really know what happened to this person, you can bet they're going to do a very thorough examination of the outside of the body, looking for bruises, maybe collecting nail clippings. You know, did this person try to fight off an attack? They will also dissect the neck, which is normally not done on a clinical autopsy because they're looking for signs of, you know, was this person asphyxiated? Were they strangled? So they're looking for things like that. So a forensic autopsy is looking at the entire person before they ever make incisions into those tissues, because they really have no idea what happened to this person and what they died of. Okay, so that's the difference between the two. We're about at 25 minutes, so I'm going to stop the video here and get this uploaded, and then we'll continue with talking about when an autopsy is required in the next video. Okay, thank you.